So diet. I like to think of diet as a better list versus a no list. Okay. You know what a better choice is, and I love giving people 3 choices, because after 3 you start to overwhelm them with too much, but 3 is a good number for a choice. So give them a choice. I actually only have 2 things listed there, but think of a choice. Post a better list on the fridge. Somehow I think if something makes it to the fridge, it's biblical or it's family special, because all child pictures are on the fridge, paintings are on the fridge. Well, put your better list on the fridge because it's right there. I have stock your fridge with better choices and portion size. Okay, there are low potassium foods, but if you eat 5 of it, it's not low potassium anymore. Or in other words, I like to think of lean cuisine ain't lean if you ate 4 of them tonight for dinner. True. It's not. It's now regular cuisine. So remember that portion size is important. Oh, and that's a lovely picture of our peach orchards in Utah. Everybody thinks that Colorado and Georgia grow peaches. No, Utah does. Double cooking tips. This is something easy, and we've learned this before and in the past, but good to share with our patients, leaching the potatoes, and also double cooking. Have them cook it. They don't need to soak it first. Just slice up those potatoes, cook it, dump the water, and then recook them again. Also important not to drink the juice out of canned foods. Even though the juice may look good, don't do it, because the potassium is in there. Use an app. Does anybody have patients that use apps for anything? Yeah, the NKF has got great stuff. A lot of the patient support networks that are online have apps. And I like to think if the patient can't do this, give it to the grandchild, and they can load it and teach them how to use this. And I'm amazed, even our older folks, our older patients are getting pretty savvy with their phones. Yes. And then my last slide, I think, before Tracy comes up here, is low potassium baths. This was new to me when I moved to Utah about a dozen years or so ago. In South Carolina, we never ran anybody on less than a 2. I come to Utah, and they're slapping 0 baths on people like they're going out of style. And I remember having chest pain on this because I kept thinking, as an NP, am I legally responsible now for the person who's running on a 0 bath for 45 minutes? Because what if the tech forgets? It's going to land on me. So please tell me that no one uses a 0 bath. Yeah. How about a 1 bath? Okay, some do ones. Once in a while. Literature out there says this is horrible, horrible, horrible. You're changing that potassium level way too fast and contributing to basically cardiac irritability. And I know that I threw a bazillion people into AFib. I don't know if I killed anyone, but I really hope I didn't. But yeah, that's what the big no for the 0. Tracy, you're up.
All right. Hopefully I'm on. I'm on. Okay. All right, Kristen, thank you very much. Now that we're all thinking potassium, Kristen mentioned in her slide that we generally don't see problems with potassium until that GFR gets down to 15 to 20 mils per minute per 1.73 meters squared. So how many of you have patients that have problems with their potassium when they're CKD stage 3? We see it a fair amount, right? Like, it is not uncommon for us to have problems. So why are we seeing problems with the potassium when patients have GFRs well over 15 to 20, when they're in the 30s, 40s? Why is that? Because those patients are on medications that contribute to the development of hyperkalemia. And most commonly in our patient population, that's going to be our RAS, or renin-angiotensin aldosterone system. Do you have my clicker?
Oh, I'm sorry, sweetie.
Where am I? There we go. The ACEs and the ARBs, right? Those are something that most people that are coming into a nephrology clinic are going to be started on, because we want to use those to try to exploit their side effect of decreasing that glomerular pressure, knock down that kidney function a bit to sort of let that glomerulus rest and last longer. Mineralocorticoid receptors are becoming more popular add-on therapy as well, and plus a number of other medications that are not uncommon to see in our patients either that can contribute to hyperkalemia. Never mind, risk factors for hyperkalemia in general include things like CKD, old age, CHF, diabetes. It sounds like 80 to 90% of the patients that we're seeing in our clinic on a daily basis, right? So just like 4 lean cuisines ain't lean if you eat them all, 4 or 5 things that can cause hyperkalemia at a low incidence, when put all together, can lead to a very high risk for hyperkalemia.